name is Elijah Sturgis, and this is my health assessment video. This is my patient right here. The legs, upper body, and the head is right here. All right. Let's see if I can back that up a little bit. Okay. All right. So I got today's 11/15/2025. Can I get your name, sir? His name is John Doe. How old are you? He's 43 years old. He's a male. And what do you do for work, sir? He's a cashier. He's a cashier. There's no representative. My name is Elijah Sturgis. I'm an RN doing the assessment. Right. The patient does appear his stated age. Sir, can you tell me your name, date of birth? Okay, so he told me his name, date of birth. Do you know where you are right now? He states he's in the hospital. And do you know what day it is? And it's 11/15/2025, from what he told me. His skin color is normal for his ethnicity. His nutritional status says he eats daily. His BMI is 20, which is in normal range. He has normal posture and position. When he sits up, his chest up and his back straight. He has no physical deformities. Face is symmetrical. No facial droop. Abnormalities noted. I'm going to ask him to get up and walk for me. He doesn't use any assistive devices. He's walking fine. His range of motion looks good. No involuntary movement. Full range of motion. Normal gait. His facial expression, he looks relaxed. His mood and affect, he's calm and pleasant. I'm going to ask him to talk to me. Just say a sentence. Just repeat a sentence. Today has been a great day. He repeated it back to me. His speech is normal. There's no slurs. His native language is English. He has appropriate mannerism. He's responding correctly to my questions, so his hearing is normal. Personal hygiene, he's clean. He showers and brushes his teeth daily. His weight is 61 kilograms. His height is 5'9" so that makes his BMI 20. Next, I'm going to have the patient sit up and stand up 20 feet away from the chart, from the Snellen chart, and I'm going to ask him to cover one eye, his right eye, and read the smallest line he can on the chart. Okay, and he read to the number 6 line, which would be 20 vision in that right eye, the left eye. Now he's going to cover the left eye and do the same thing. And I want you to read the lowest. He's 20 feet away. I want you to read the lowest letters on this chart from the bottom, from the top to the bottom. Okay, and he read from line 6, which is 20/20 vision in that eye. There's no correction needed to be made. I'm gonna lie him back down on his back. gonna feel his radial pulses. I'm gonna count for a minute. All right, they're regular, 72 beats per minute. Next, I'm gonna listen. I'm gonna look at his respirations. Next, I'm gonna look at his respirations. I'm looking at his rate and his depth. He has a regular rhythm, 18 respirations a minute, unlabored normal depth. Next, I'm going to check his blood pressure. I don't have a blood pressure cuff, so I'm just, One, puff, 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 puff. And his right arm, I just got 122/74 sitting. We should be sitting. Now I'm going to do his left arm. And I'm going to do his left arm. Check his blood pressure in his left arm. See any abnormalities or differences. Placing this above the antecubital region. I put the blood pressure cuff on. I'm pumping it up. Pump, pump, pump. All right, I'm releasing the air. Listening for that thud. All right, and I got 128/75 sitting on that left arm. All right, I'm going to check his temperature. This is my oral thermometer, putting it in under his tongue. Beep, beep. All right, it's 98.2 degrees Fahrenheit. I'm going to ask him, hey, are you in any pain? Is there any pain anywhere? Stating no pain. All right, now I'm standing in front of the patient. The patient's sitting. I'm looking at his hands and nails. They're symmetrical. Nails have normal capillary refill. Checking them. 4 range of motion. He's extending the fingers, closing his hands. All right. The color of his skin is normal. He has a white color, normal pigmentation. His temperature is cool. Moisture, soft moisture of the skin. Texture is smooth. Normal turgor of the skin goes right back into place when I pinch it. No lesions, bumps, or bruises. Next, I'm going to check his scalp. Looking at his scalp. All right, it's normal, symmetrical, and no flakes in his hair. Next, I'm going to be looking at his face, testing cranial nerve 7. He has normal motor function in his face. He's able to raise his eyebrows, clench his smile, raise his eyebrows, squeeze his eyes together, squeeze his eyes shut together symmetrically. Next, I'm going to check his temporal artery and temporomandibular joint. So his temporal arteries, there's no swelling. It's non-tender. I'm going to feel on his, right in front of his ear, the temporomandibular joint. And I'm going to feel for a popping when he opens his jaw. Can you open your jaw? And I don't feel any popping on either side. No swelling, non-tender. Next, I'm going to check his sinuses, his maxillary sinuses and his frontal sinuses. His frontal sinuses right here, and then his maxillary right below the cheeks. There's no pain or pressure in the sinuses, which is good. It's normal. Next, we're going to do the eyes. This is cranial nerve number 2 I'm checking. his visual fields, full and consistent. And then his extraocular muscles, corneal light reflex, cardinal positions of gaze, cranial nerves 3, 6, and 5. No, 3, 6, and 4. I believe no. Cranial nerves 3, 6, and 4. Yeah. Okay. So I'm gonna get my light. I'm gonna shine my light in the patient's eyes, looking for the, pupils are equal, reactive, round, and light. Looks like they're about 4 millimeters. Looking at if they're conjugate, the eye movement, no nystagmus. I'm gonna ask him to follow my pen. I'm gonna pull into his eyes, see if the eyes come in together. I'm gonna tell him to look straight. I'm gonna bring my pen forward and let him know when he sees it. He sees it, and I'm gonna pull it forward. I'm gonna ask him when he sees it. He's saying he sees it. I'm gonna do the same thing down here. Up here, says he sees it. Seems like the peripheral vision is normal. Looking in his eyes now. His conjunctiva, normal appearance. The sclera is white. Corneas are clear and smooth. The iris is normal. Pupils are equal, round, reactive, 4 millimeters, both of them. Next, I'm going to use the ophthalmoscope. Just getting it right here. Put a clean piece on. I'm going to look into the eye, and I'm looking in the back of the iris, or in the middle of the eye, and it's symmetrical, has like an orange glow. Looking at the disc, it's normal, yellow, round, and equal. The vessels are normal. There's no hemorrhages. Retinal is red, no hemorrhages. Next, I'm going to go to the ears. Looking at both of the ears, this one's and that one, symmetrical, normal symmetrical. They're non-tender. There's small hairs, yellow earwax in the ear. When I use the otoscope to look in the ear, there is a pearly gray translucent appearance, which is normal in both ears. We'll look in the other ear. Yep, same thing. Normal, pearly gray translucent. I'm gonna test his hearing, cranial nerve number 8, and what I'm gonna do is I'm gonna whisper a sequence of numbers and letters in his ear, and I'm gonna see if he repeats it back to me, and repeat the same correct letters and numbers that I've said into his ear. So I'm gonna whisper behind his ear so you can't see my lips. And he repeated back to me 5K2, which is what I whispered in his ear. So he has normal test hearing, and I'm going to do it in this other ear. Same thing. He said he correctly responded what I whispered in his ear. Next, I'm going to look at his nose. I'm looking for if it's symmetrical. I'm going to ask him to hold one nostril and blow out the other, and for both sides to make sure they're patent, nothing blocking it or obstructing it, and they both are patent. Next, I'm going to look up his nose. I'm using a light, looking up his nose, looking at the mucosa, seeing if it's normal in appearance. Looking at the septum, if there's any swelling. There's no swelling. Any turbinates, minimal secretions, pink, moist, all normal. Next, I'm going to look at his mouth or assessing the mouth and the throat. He has his mouth open. I'm looking at his lips and buccal mucosa, smooth, pink, and moist. His lips, they're not blue, so I know he's not having a hard time breathing. Now I'm going to look at his teeth and his gums. Can you open your mouth for me? And I see that there's no cavities. Gums are firm, non-tender, no bleeding. I'm looking at his tongue. It's pink, it's moist, it's symmetrical. I'm looking at his palate. It's pink and firm. His tonsils, they're pink, oval shaped, and symmetrical. Now I'm going to test his cranial nerves 9 and 10. Um, I'm going to ask him to say ah, and when he says ah, the uvula comes forward, comes up and forward. Then I'm going to take my tongue depressor, put it in his mouth, checking for a gag reflex. He does have a gag reflex. Um, Thank you for letting me do that. And then I'm looking at cranial nerve number 8 to checking his tongue. I'm asking him to stick his tongue out for me. I see that it's straight. There's no deviation when he sticks it out. All right, next I'm going to check his neck, looking at symmetry, any lumps, pulsations. There's no masses. It's regular. Carotid pulses are okay. Next, I'm looking at his lymph nodes. If they're tender, swollen, non-tender, they're not swollen. All right, then I'm going to feel his carotid pulses on both sides. They feel normal. They're not bounding. Then I'm going to listen with the bell of my stethoscope for any bruits. All right, I heard no bruits, which is good because there's no obstruction. What's next? Now I'm looking at the trachea. He's looking straight. The trachea is midline position, no deviation when he's breathing. I'm going to look at his neck. He's testing cranial nerve number 11. Asking him to. I'm going to push down. I'm going to push down on his shoulders. I'm going to ask him to push up against me pushing down on his shoulders. All right, and that's normal. And then I'm going to ask him to just rotate his head, just checking his full range of motion on his neck. And he has normal strength and full range of motion. I'm going to come to the back of the patient now to check his thyroid gland. Checking the thyroid gland, feeling it's not visible. It's soft, smooth, symmetrical. All right, now the patient is supine again, putting the patient back in supine position. I'm going to be on the right side of the patient, checking the jugular venous pulse. It's impalpable, which it should be because you shouldn't feel that and you shouldn't be able to see it if they're 30 or 45 degrees sitting, because that could indicate heart failure. Next, I'm going to assess the heart, pulsations and heave. I'm checking the pulsations. There's no pulsate. It's gentle pulsations with no heaves. The apical impulse is gentle. The precordium, there's no thrills. Next, I'm going to listen to the apical pulse to get the beats per minute and the rhythm. Listen it for a full minute. I'm listening to it to a full minute with my stethoscope. All right, I got 72 beats per minute, regular rhythm. S1 and S2 were heard and at normal intensity. All right, next I'm going to check the abdomen. It's flat, symmetrical. The skin is consistent in color. No lesions. The umbilicus is midline. No pulsations. Vowel sounds. I'm going to listen to all quadrants. Right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. high pitched in all quadrants, normal bowel sounds. I listened for any vascular sounds. I did not hear any vascular sounds, which I don't believe you should be hearing any vascular sounds in the belly. The percussion, I'm gonna percuss now his abdomen. Start in the left lower quadrant, right lower quadrant, left upper quadrant, right upper quadrant, and left upper quadrant. There's timpani percussion in the left lower quadrant, left upper quadrant, and the right lower quadrant, and some dullness over the right upper quadrant, which is normal because the liver's there. Next, I'm going to do some light and deep palpation. In all quadrants, it's soft, non-tender, without masses or swelling, which is good. Next, I'm going to palpate the liver, spleen, kidneys, and the aorta. The liver is in the right upper quadrant. It's smooth, soft. The spleen, I can't palpate it, which is normal. The right kidney should be palpable, but the left kidney is not. And there's a normal aortic pulse. All right, and now I'm going to check the abdominal reflexes. I'm just going to stimulate each side of the abdomen. All right, and when I stimulate it, the side I'm stimulating contracts, which is normal. On both sides, it's symmetrical. All right, next I'm going to check the lower extremities. The length of the lower extremities are symmetrical. I'm going to ask him to raise his leg, both legs, bend his knees, full range of motion in both extremities. The skin characteristics, it's warm, it's dry, not warm, dry. The hair is distributed evenly on the legs. I'm going to check the posterior tibial pulses, which is behind the knee. They're normal, symmetrical. Pulse is strong. Pulse strength is normal. I'm going to check the posterior tibial. It's normal, symmetrical rhythm. Pulse is symmetrical. Pulse strength is good. Dorsalis pedis pulse, which is on top of the foot. Normal and symmetrical. Pulse strength is normal. Next, I'm going to check the temperature and any edema by the tibia. I don't feel any edema. It's warm to the touch, but no edema. The toes, checking the toes. He's able to move all of them, good range of motion, flexing up and down. They're warm, no swelling. Warm, no swelling. Normal cap refills on all the toes. All right. And I've assessed all his range of motion everywhere, his overall strength in all extremities against gravity and maximal resistance are great. They're normal. He has full range of motion in all extremities against gravity and maximal resistance. And this will conclude our assessment, and thank you, Mr. John Doe, for your time.